Hello, my name's Ash Cook. I'm a PA in orthopedics. I've been practicing as a PA for over 15 years. Many years in multi-specialty surgeries and emergency medicine. I'm here talking to a patient here in the orthopedic clinic, Miss Dorothy Murray. She's become a good friend of mine over time as we've taken care of her for several ailments. And I just wanted her to be able to share her story with you and talk a little bit about nutrition.
Satisfied with the diagnosis that I was getting from the doctor I was with, so I got a second opinion. Well, the second opinion led me to Dr. Mark Stevens, because that doctor says it's more than just arthritis. There's something that's not right here. Awesome section has been added to here, and so they have really worked so well with me, but we were still having pain in the other hip and the knee. And once again, in fact, Dr. Stevens was very cautious. He was very thorough, because when he wasn't just x-raying the surgical site, he wasn't just looking at the surgical site, he was x-raying the other joints to see how the deterioration was progressing. And we reached a point where now we got to make a decision. Do we do the hip or do we do the knee first? It's almost like drawing straws. After 2 surgeries, and this was when I was introduced to H3 Rapid Recovery, and we talked about comparing my healing process. And I'm really good on nutrition, because I've taught senior fitness for 15 years, so I'm going to not eat a lot of junk food. I'm going to be healthy. But I realized that I could, over the last 2 surgeries, that no matter what I ate, that my body may not have gotten out of that food what it needed. My body may require more protein than someone else. It may require a different type of vitamin or mineral. And to have a doctor that has the knowledge and the ability to formulate something that works like this does in your body is awesome. So now we're going to compare the 3rd surgery with the first 2. And I started on H3 Rapid Recovery. I'm thinking about a week or 2 prior to surgery and a month afterwards. And my healing process was really great. It was a lot different than the first 2 surgeries, I have to say. I got along well. I didn't even have home care therapy. I went right straight into outpatient therapy with that. And I was anticipating this one being a little more...
Taking more time.
Taking more time, a little... maybe some pain, or maybe something else different. Because
typically knees take a lot longer to heal and recuperate than a total hip. What's important, really important, one of the points that you made is that not only do different folks have different nutritional requirements depending on age and depending on their own individuality of their metabolism, just like we have different hair color, different eye color, different personalities, we do actually have variations in how we metabolize. And how our protein structure, etc. So it's important to get the right nutrition for you, but not only that, but a lot of foods, even if we think we're getting what we need in today's, in this day and age, how we process foods, how we manufacture foods, and how we store them has a huge impact on the nutrient content. And unfortunately, a big majority of the food that we eat, the processed food that we eat, is just way devoid of the key nutrients that we need. Not just vitamins, not just minerals, but some proteins. A lot of folks think of protein as just building blocks. You take protein powder to build muscle. We're basically made of proteins. Proteins are like saying building materials. There's all different types, and some of them are you just need a few of these key proteins in very small amounts, but without them you can't function, or you function poorly with not enough. And that's what's important about getting good nutrition, where you see these dramatic changes in the same patient within a short period of time. A surgery here and a surgery here just months later, and they have a dramatic increase in their rate of recovery and how they feel, and they have the energy to go to physical therapy and really perform and that kind of thing. That's where I think that the big impact on nutrition that we see.
Well, it's like you said, the dramatic change is because I've already had 2 surgeries. And now I'm looking at the other 2, and the comparison is astronomically awesome. I mean, it's blown me away, and people that know me and have seen me for the past 5 years and know where I've been has looked at it. But yes, I began on this and I can tell. I mean, I can even look at my skin. Anything I want to look at, my hands or anywhere, not just my incision site, my energy level, the way I eat food, and everything. This supplement that is there my body has pulled from it what I needed. So therefore, it's come in there to do what I know protein as being a healer, not just the muscle builder, as you said, but it's a healer. But it's pulled not only that, but what's in the formula that I need, and has worked with my foods and my level to get me in there far.
Unfortunately, when you have degenerative joint disease, which most often is just osteoarthritis, or another name for wear and tear, like wearing out a set of tires kind of thing, we do wear out the pad in our joints over time, and no matter how good your nutrition is, typically what you're doing with good nutrition is arresting the rate of decline, but you can't grow a whole lot of new cartilage. You're not going to build brand new cartilage and go back in time to a younger joint. So we just kind of slow that down as best we can with good nutrition, and sometimes we reach the point at where you don't have much tread, just like you wouldn't have much tread on a tire, and you get to the point where all you can do is replace the joint, and then we're looking at recovery, and that's what we're talking about here.